Bismillahirrahmanirrahim. Assalamu alaikum. In this video we will study about the Streptococcus pyogenes, also called the Streptococcus group A. Now let's break down the name of these bacteria. Streptococcus means that it exists in the chains and it is spherical in shape. Strept means it exists in the form of chains and coccus means it is spherical in shape. And what does it means by the pyogenes? Pyogenes means that it is able to produce the pus in a localized infection. So any bacteria that is able to produce a pus is called a pyogenic bacteria. Here you can see its visual representation, how it looks under the microscope. Now let's see the general features of these gram-positive cocci. As these are gram-positive, so they will appear purple or violet under the microscope, and these are catalase negative. In this sketch you cannot see any cat, so it is catalase negative, but it is beta hemolytic in nature. Here you can see this light is represented by the beta sign, so it is beta hemolytic in character. Another feature is that it is an encapsulated bacteria. Streptococcus pyogenes are encapsulated bacteria and its capsule contains hyaluronic acid, that is represented by this hot apple. H and A refers to the hyaluronic acid. The other thing is that it is bacitracin sensitive. What does it means by the bacitracin sensitive? Actually, bacitracin is an antibiotic that can cause the death of these Streptococcus pyogenes in the petri dish or in their colonies. It can cause the death of the colonies of Streptococcus pyogenes. So we will say that it is bacitracin sensitive and we will perform such lab test. And it has an enzyme that is called the pyrrolidonyl aryl amidase. So it is PYR positive. Now let's see what are its reservoirs. Its reservoirs are human throat and skin. Human throat and skin. So its infections will most likely to be related to these two spaces. Okay. And then transmission. It is transmitted through the direct contact or through the respiratory droplets. Now let's see the pathogenesis of these bacteria. Actually, the hyaluronic acid is one of the pathogenic factors. It is non-immunogenic, so it will not cause an immune response, and its function is that it will hydrolyze the ground substance of the connective tissue. Then the second most important pathogenic factor is the M protein that is present in the cell wall carbohydrate. It is anti-phagocytic. It means it will not allow the phagocytosis of the bacteria by phagocytic cells, and it is represented by this M. This baker is actually, or the chef is actually the M protein, and that is not allowing this phagocytic cell to eat bacteria. Next virulent factor is the streptolysin O. It is immunogenic. It is able to produce the immune response. It is hemolysin. It means it will cause the lysis of the blood, and cytolysin, it is also able to cause the lysis of the cells. So actually hemolysin and cytolysin are the short form for the hemolytic toxins and the cytolytic toxins. And streptolysin S is not immunogenic, but it is hemolysin and cytolysin. So these were the four pathogenic factors. One is hyaluronic acid, M protein, then streptolysin O and streptolysin S. Then what are the spreading factors? So there is another kind of enzyme, that is streptokinase, that breaks down the fibrin clot, that is actually preventing the spread of the infection. When this fibrin clot will be broken down, then the infection will spread to the far sides. And you can see these streptokinase are actually represented by these cupcakes that have the P or the phosphate group on them. Okay. Second spreading factor is the streptococcal DNases. These streptococcal DNases liquefies the pus and they cause the extension of the lesions that are represented by the twist breads. So here these twist breads are actually representing the DNases that liquefies the pus and causes the extension of the lesions. And the other spreading factors are the streptococcal pyogenic exotoxins A, B and C. These exotoxins A and C are actually phage coded and they cause fever and rash of the scarlet fever. And the streptococcal pyogenic exotoxin B causes the necrotizing fasciitis. Now let's see how these are represented by this sketch. You can see this exotoxin B is causing the necrotizing fasciitis, and you will see that it is most common in the plantar region, in the foot region. Fasciitis actually means the inflammation of the superficial fascia or the deep fascia, and you know the superficial fascia is just under the skin, and that is also called the subcutaneous tissue, and the deep fascia is one that covers the muscles, so it causes the necrosis of that fascia. See the diseases that are caused by the Streptococcus pyogenes bacteria. So these diseases are actually grouped into three types. First one are the pyogenic disease that include number one pharyngitis, number two cellulitis, number three impetigo, and these impetigo are actually honey crusted lesions of the skin, and the number four is erysipelas. Erysipelas are actually the erythematous lesions, erythema of the skin. And then toxigenic diseases. Toxigenic diseases include scarlet fever, toxic shock like syndrome, and necrotizing fasciitis. And the number three are immunologic diseases, which include rheumatic fever and glomerulonephritis. So let's revise them again. Pyogenic diseases are pharyngitis, that is most common, cellulitis, impetigo, erysipelas, and toxigenic diseases include scarlet fever, toxic shock like syndrome, necrotizing fasciitis. Immunologic diseases include rheumatic fever and glomerulonephritis that may be late in their onset. See how all these diseases are represented in this sketch. You can see that all these bakers are wearing the red handkerchiefs around their neck, so it means that this bacteria will cause the pharyngitis. The second disease that we studied was the impetigo. Impetigo is actually a skin infection that causes the honey crusted lesions on the skin, and actually it is represented by this lemon pie, that is lemon crusted, and so this disease is actually impetigo. And the third disease that we studied in our pyogenic class was the cellulitis, and cellulitis is represented by this baker who is wearing the big red mittens, so it also causes the cellulitis. From the toxigenic class, we had a disease that is called a scarlet fever, that is represented actually in this disease scarlet fever. There are symptoms of pharyngitis that are followed by a blanching sandpaper rash with palms and soles and face usually spared, and that is represented by this gingerbread. You can see that its palms and its soles and its face is spared, but the rash is all over the skin other than the face, palms and soles. Then the other symptom of the scarlet fever is the circumferal palate, strawberry tongue, that is represented by this uh, chef that is eating a strawberry. So and his tongue is also white, so it is represented that it will be having the strawberry tongue. And the next two toxigenic diseases were the toxic shock like syndrome and necrotizing fasciitis. These are actually caused by an super antigen. There is a super antigen that invades fascia under the skin and spreads very rapidly, and it becomes a medical emergency, and amputations are common. So the baker wearing this super cape lightning, you can see that this shock is represented by toxic shock like syndrome is actually represented by this shock symbol, and he is actually wearing a superman kind of a dress, so it is a super antigen that is causing the this shock, toxic shock like syndrome. In a type 2 hypersensitivity, there is a M protein that mimics the myosin in our heart and causing our own antibodies to attack the heart, specifically the mitral valve. And how it is represented by the mitral valve, that the master chef is actually wearing the mitre hat. So this is represented by the mitral, that it will cause the damage to the mitral valve. And other symptoms of the rheumatic fever are characterized by the Jones mnemonic, that is represented by these cupcakes, and where J means the joints or the polyarthritis, and the O in the form of the heart represents actually the heart problems of the valve defect, myocarditis and pericarditis, and N actually represents the nodules subcutaneous that appears on the extensor surface of the forearms, elbows and knees, and E represents the erythema marginatum, that is a rash with red borders, and the S actually represents the Sydenham's chorea of the rapid involuntary movements of the hands and feet. Now let's see how these are represented. J means joints or polyarthritis. O or the heart shaped means that it is presenting the heart valve defects, and means there are several kind of the nodules will form on the extensive surface of the forearm and elbows and knees, and E represent the erythema, and S actually represent the Sydenham sporia, that is represented by that this cupcake is falling. So these are the rapid movements of hands and face, so it is represented by S. The next thing that will happen is the acute glomerulonephritis. Acute glomerulonephritis is also immunogenic disease that is caused by the Streptococcus pyogenes. In case of the acute glomerulonephritis, a type 3 hypersensitivity where immune complexes binds to the glomerulus and causes the edema and hypertension as well as the smoky cola colored urine. Glomerulonephritis will occur after 2 weeks of the infection. This wire is actually twisted in the form of the glomerulus, representing the glomerulonephritis. And the other thing was the cola shaped urine. This is represented by the cola colored urine, and hypertension and edema is actually represented by these puffy cheeks. So these are various symptoms of the acute glomerulonephritis that will occur 2 weeks after the infection with Streptococcus pyogenes or the Streptococcus group A. Now, how we will diagnose these bacteria in laboratory? For this we have a rapid strep test, that is ELISA based enzyme linked immunosorbent assay based test that misses approximately 25% of the infections. It cultures all negatives, and as it is linked to the immunoassay, it has the antibodies related form. So we can see that this lady who is actually carrying antibody shaped tongs is showing that this disease or the Streptococcus pyogenes can be diagnosed by the ELISA based test, that is rapid strep test. Treatment, actually it is treated by the penicillin, although it doesn't protect from the glomerulonephritis. How it is represented, that this chef is carrying pencil, so it can be treated by the penicillin. However, macrolides are used in the patients who have the penicillin allergy. See the prevention from the Streptococcus pyogenes. For this we have the prophylactic antibiotics that should be considered in patients for at least 5 years post acute RF, beta lactam, penicillin and macrolides.